wondering what liens are associated with a nursing home neglect case? We have some answers for you here. We often represent folks who have family members, parents, loved ones in a nursing home, and because of the failure of the nursing home to provide adequate care or the nursing home's neglect, the family member, the loved one, suffers an injury, whether it's development of bed sores, whether it's a fall as a result of not being monitored appropriately, resulting in a fractured hip or an arm or a head injury. We've seen many of these cases. There are some commonalities among these cases, one of which is that in most of these cases, if the case comes to a point of a resolution, there will be a lien asserted by some provider who has paid for some of the medical care or some of the nursing care. Most often, this is from Medicare or Medicaid, and that will differ depending upon how the individual planned or what assets they had at the time that they went to the nursing home. In many cases, individuals who do estate planning don't have any assets for the purpose of when they go into a nursing home, and because of that, Medicaid will cover a portion of the costs of the nursing home. If that person is then injured at the nursing home and brings a legal claim, or their family brings a legal claim against the nursing home and they get a recovery, Medicaid will then say to them, we would like to be reimbursed for the expenses that we had to incur as a result of the care that you received arising out of this negligence. Similarly with Medicare, those folks who receive Medicare and have Medicare pay for some portion of it will also receive some notice from Medicare that says, hey, we want to be reimbursed here if you're getting paid. Now, this is part of the representation that we provide to families in these situations, but it's really important that we identify who's paying for the care and whether they're going to have a lien against any recovery. And when we say a lien, they're not just asking, they're demanding, and they have a legal right to recovery. So it's not something that can be ignored. It has to be taken care of at the time of the settlement. And it's also important to keep that in mind in terms of negotiation and setting expectations about what your family might be able to receive and ultimately what the net might be after everything is paid. Because those two numbers are often different, and so it's important to have those discussions early on. If you have questions about liens or care at a nursing home in particular, feel free to reach out to us.